everyone, so if you don't know who I am, my name's Claire Carmichael and I'm a second year adult nursing student. And today I'm going to talk to you all about things that you should be doing before you start university and in the first couple of months of starting university, and I hope it helps somebody out there. Firstly, I just want to say that every university is different, so I'm just going on my own experiences and what my university does. I'm at Birmingham City University, so these are just some little bits of disclaimers, that I have to put out there, that every university is different, so check with your university if there's anything else that you need to do. You're coming up to September, you're about to start university, and you're going to need your checklist, so write these things down. Number 1, have you done your DBS? Have you filled it out and have you sent it off? Number 2, finance. Have you applied for your finance yet? You should have. Number 3, have you had an occupational health appointment at the university? They should have emailed you or maybe even telephoned you, get you in for your occupational health and make sure that you're up to date with all your vaccines and everything, because when you start nursing, you need things like your hepatitis B, TB, things like that. So go in and get that done, and don't worry about it. Don't panic. Just relax. Do you have your start date? And this sounds really simple, but sometimes there's a technology failure, something's happened, there's an error somewhere. This happened to me, unfortunately, and I didn't get my start date and I ended up missing my first week, unfortunately, but luckily it was sorted out and they were really good about it. And yeah, so I just want to say, if you haven't got your start date, ring them, email them, anything you can do to get your start date. Next thing, have you submitted all of your certificates and evidence that you need to say that you can do the degree, whatever the conditions were in your application form? Have a look. Last thing in this section is, do you have everything you need? Have you got the right amount of pens, papers, different colours, your fob watches, calculators, all that jazz? I did do a vlog on everything that you need for your first year for nursing, so I'll put the links below and just go and check that out if you want. It's up to you. Let's start with the first day. So your first day, it's going to be really overwhelming. It's going to be really nerve-wracking, especially if you don't know anybody and you're going in just completely alone into this, because that was me. I was that person. And it is really scary that first day, but do you know what? You get over it and you start talking to people and everyone's in the same boat. You have to remember this. You're not going to be the only person there that's alone. There's going to be other people there that's alone. So if you spot somebody that's on their own, looking a bit glum, looking nervous, go say hi, wave at them or something ridiculous. Make friends. And then, okay, so your first week/month can be overwhelming as a whole, because you're going to get a lot of information thrown at you. Your timetables, your placements, exam days, everything's going to be chucked at you in the first month. So please don't stress, just take some time to just absorb all the information. Take some time to adjust to the university life, because it's okay that you don't adjust. It took me a couple of months at least to adjust fully to university life, and you need to just be comfortable and don't panic, because if you don't know something, there's always someone to ask, or there's online resources to have a look at. One of your colleagues will know, someone will know. So just don't worry if it's a bit overwhelming. Just settle yourself in, and yeah. So when you start, you will be given a personal tutor. This is your first point of contact if you have any issues, any problems. The personal tutor is also the person that looks after you for the 3 years, and they're going to be writing your reference at the end. And it's just nice. It's nice to get to know your personal tutor, I think. Yeah, so you will be given your personal tutor when you first start. So make sure you send them an email, say hello, introduce yourselves, and ask them what they want from you as well and what they expect. And you can just go from there. And make sure you attend your mandatory sessions. So you'll have manual handling, basic life support, hospital life support, whichever one they call it. There'll be information governance, things like that, mandatory sessions, but they'll tell you about this and they will warn you that they're mandatory before you go out on your placement. You have to have these sessions, so make sure you know when they are and go to them. And then next, make sure you download and print your timetable off. Make sure you have a look at your dates, what's coming up next, what exams, what assignments, when your placement's going to be, and just prioritise everything in order. Put it on your calendar, print it, put it on your wall. Make sure you know where you are, what time you're at places, and just start to organise yourself, because you're going to need that for the 3 years. Another might be a strange tip, but read your emails. Go onto your university emails. I do mine daily. actually probably twice a day. I'm addicted to checking my emails. But please go onto your emails daily, because this is your point of call from the university. So if they've got any important messages or anything, that's how Birmingham City contact us. We always get emails and updates and things. There might be a forum for you on the university website that you can go on. It just depends how your university works, but just find out. But just, yeah, check your emails and don't miss any important information that they might be sending you. Also, I just want to say, make the most of events. If you've got events and things going on at your university, take some time out, go to the events, meet new people, mingle with the other cohorts, mingle with the other fields of nursing or different subjects completely. Just go and speak to those students and mingle, and just make the most of your time there. It's going to be a really long 3 years if you don't make the most of it, and if you're just, you know, dragging your feet and getting by, and I don't want that for you. Please make the most of university life. If there's an event about and you want to go to it, go to it. That's just one of my top tips, I think. My next top tip is, this is just a personal love of mine. It's not for everybody, but I love Twitter, and everyone I feel should be on Twitter, but that's just my personal bubble. I know that's not for everybody. Please don't shoot me down. Twitter is a swear word to some people, so I'm very sorry about that, but I personally love it, and for your personal professional development, it's really, really good, and you're gonna come into networking with so many different people across the NHS. It's fantastic. It's really, really good for your professional development, I think. So 2 weeks before, at least on your placement, call them up, introduce yourself, find out who your mentor is, get your shifts booked in. Also, it's really good if you arrange a visit as well before you start, because if you go onto the ward or community or whichever area you're going into, it's really nice to go and speak to these people, see these people before you start, so you're in a more relaxed environment because you're not in your uniform and going, if that makes sense. So you get to see everyone and just get a feel for everybody, and that will just completely erase half the nerves that you're feeling right now about it. Also, because your first placement, don't panic if you don't know anything. People are going to ask you questions, assuming that you're a second year student or third year student. I had a couple of people thinking that I was a third year student. I was like, I'm the first placement, and they expect you to know a lot, and some people, they just don't take into consideration, okay, you are a fresh new student, and it's okay, it's completely normal to not know anything. So don't worry about that, don't panic if you don't know anything, just be honest about it. Just say, listen, I'm really sorry, I don't know, but can you just explain it or show me, and they'll be fine about it. Also, keep a little pocket notepad when you go out onto placements, and a pen in your pocket, because it's really good to write everything down. I've got a little notebook myself, and I've literally just written little bits that I've learned along the way. It's just full of knowledge and little tiny, just, it doesn't even make sense, some of it, but I understand it. But if someone else was to read it, they'd just be like. So keep a notepad in your pocket, and it's really good. If your mentor tells you anything, explains anything to you, literally just jot it down, and mentors love that as well. So that's a really good tip. If you can grab hold of a BNF, I've said this in a previous vlog, if you can grab hold of a physical BNF, get it, take it home, love it, it's your Bible. If you can't get hold of one, they are free from pharmacists. If you go to any pharmacy and just say you're a student nurse, have they got any old BNFs that you can have, they will give you one for free, because they've got no use for them, because they get one fresh every year, so steal it. But if you can't find a BNF anywhere, don't worry, because there's a BNF app. The BNF app's really, really good. It's just the same as the book. I just like having a physical book to look at. But the BNF app's just as good, and it's all the same information, so it's easily just download, do it. Because that's going to be your Bible for the next 3 years. You are going to use it. It's going to be the most used thing you ever use. Out of every book anyone's ever told you, you need a BNF, whether it's the app or book. But if you don't get it, don't worry, because the wards always have a BNF hanging about that you can look at on the ward. Obviously don't take that one because they need it, but it's something that you can look at. And also just be mindful, if you've got the BNF app on your phone, don't get your phone out on the wards, because you're not allowed your phone on the wards, or whichever area, not just wards but community, whatever. Just be really mindful of having your mobile phone, and just keep it away, keep it on silent, turn it off. Don't touch it whilst you're working on your placement. It's really not worth the hassle that it will cause. But if you do really need to look up a drug and the only option you've got is to use your phone, just go and find your mentor or whoever you're with at that time and just say, listen, I'm just going to look this up on my phone, is that okay? And just explain exactly what you're doing, because you don't want people to get the wrong impression of you, if that makes sense. And last but not least, I just want to say, when you go onto the ward, it is very busy. You know, you're going to be out there, you're in the real world, there are real patients that are really sick out there, and your mentor is going to be so busy. So please, I just want to say this now, don't get disheartened if your mentor is rushed off her feet, she hasn't got time for you. If she's putting you with HCAs to go around with, please don't be offended. That's a really good thing as well, because HCAs are amazing, they're so knowledgeable, they're really good to learn from. So honestly, embrace that if you're put with the HCA to go around with, because they're fantastic. So my main point is, it is very busy, so don't be disheartened. I know some people have got disheartened before because their mentor didn't appear to have time for them, but it is the real world. They are understaffed, and it is a struggle to fit those students in, as well as dealing with their patients. So don't worry if they can't sign your book on that day, it can be done tomorrow. So don't worry if they haven't got time for you. But at the same time, if you're not learning, and because you are there to learn, you're there to train, if you feel like you're not learning and not getting the experiences you want, maybe just ask somebody. If your mentor's busy, see if you've got a buddy mentor or another nurse, and just say, oh, I'd really like to experience this, do you mind if I come and watch you do this? It's all about the way you approach a situation. You know, we're not there to kick off at people because it's not their fault, it's a real life situation, and they're there to do their job at the end of the day, and the patient comes first before anybody, before us. So if there is something you particularly want to do, you can ask. Please feel free to ask about pathways and things that you can go on as well. Any experience you can get involved in, get involved in. So that is it. That's my top tips and advice for placements. And just remember as well, not everyone has the same experience. Every student will experience something different depending on the area they're in, depending on their own life circumstances. So you have to make this your own. This is your next 3 years of your life. You're going to be living and breathing nursing, or even any course you're doing right now. You're going to be living and breathing this course for the next 3 years. People are going to become your family, and it's just make the most of it, enjoy it, embrace it and love it. And for now, see you later.